Hi everyone, welcome to today's webinar from the SPSP Acute Adult Deteriorating Patient Programme. We'll just be allowing a couple more minutes for people to join and then we'll get started, okay? Okay, welcome everyone to today's webinar, which will be running till 3:30. This is part of the SPSP Acute Adult Deteriorating Patient collaborative webinar series. And today we're going to be focusing on using eObservations to recognise and respond to deterioration. Okay, so next slide, please. As per any Health Improvement Scotland meeting, I'm sure you'll all be used to this. Just to save everyone's peaking bandwidth, I'd be really grateful if, when you're not presenting or speaking, if you could turn your camera off and keep yourself on mute as well. As we go through the presentations today, our Q&A is a combined Q&A at the end of the session. But once we get to that, if you do want to make a point or raise a question, then feel free to put something in the chat or to raise your hand. Okay. If there are any technical difficulties, Sarah from our his team is on hand to help, and you can either contact by messaging the chat or emailing at the His Acute Care email address that is on the screen there. Okay, so the aim of today's session is to really share learning from 3 of our health boards, NHS Fife, NHS Lothian and NHS Lanarkshire, regarding the different approaches they have taken to the issue of developing electronic observation systems. And you'll hear 3 stories from 3 good friends of our programme about how they've gone about implementing electronic observations, and they're all at slightly different stages in this whole process as well. So hopefully that will be really useful to yourselves who've already implemented systems, or also useful to you if you're planning to implement electronic observation systems. We'll touch on the benefits and challenges regarding these systems as well across NHS Scotland. Okay, so next slide, please. So to delve into the programme, I'll kick off with a bit of scene setting around approaches that have been taken outside Scotland. And then it's my good friend Gavin Simpson, fellow intensivist from South East Scotland, talking about the well-established eOb system in NHS Fife. Nicola Moran, a consultant anaesthetist at NHS Lothian, will then talk about the system in NHS Lothian, which is launching essentially as we speak in NHS Lothian. We'll have a short break, and then to bring it all together, we're really pleased to have Karen Goody from NHS Lanarkshire, who will talk to us about their experience of the patient track system. After that, we should have good Q&A, and I can see there's lots of you on the call who could well contribute to that Q&A, and we're expecting to be joined by other colleagues who've contributed a lot to eObs across NHS Scotland, such as Gillian Macaulay, Acute Nursing Director at NHS Lothian, who I think has led the NHS Lothian programme and has also been heavily involved in the Lanarkshire programme as well. And to close, we'll just talk about a few learning events that may be of use to you coming down the line from the SPSP programme. Okay, so electronic observations is incorporated into our SPSP acute care deteriorating patient collaborative, and I've not put our driver diagram up there, but it's one of the ways in which we can think about improving our electronic observations. I'll leave it to the speakers to say how why that might be effective, but it's interesting to reflect about this is an issue that's being challenged in many other healthcare systems as well. I have to say, for my own part, my first consultant job was in some time ago now in NHS England in Nottingham, and we implemented an electronic observation system down there. And if you look at NHS England as a whole, many trusts have used different systems to electronify their use of News 2. Interestingly, I was recently at the Deteriorating Patient Conference in June in Dublin, hosted by the Health Service Executive in the Republic of Ireland. And they've taken a slightly different approach to both NHS England, but also NHS Scotland, in which they, in their public hospital sector anyway, have taken very much a centralised approach. They've launched their iNews, which is very similar to News 2, as a scoring system across all their public hospitals, and have a national standard in terms of observation frequency. They also have a plan to launch one single electronic observation system across their acute hospitals, and they've trialled that in Cavan General Hospital in the north of the Republic. And it was really interesting to hear their kind of initial pilot study and the effects they've had in terms of their uses of electronic observations. Some of the challenges may be very similar to the ones that you're about to hear about from the speakers, but there's also some of the benefits, such as the effect on nursing workload and potentially freeing up time to care. So it's interesting to think about those different approaches. If we go into the next slide, that one solution for Scotland ship may well have sailed, and as you know, if we look at the use of electronic systems across across Scotland, there is huge variation whether we look at electronic records and now electronic observations. And you're going to hear three slightly different stories about three different projects from our boards. It's worth saying and just highlighting that we are currently, and some of you on the call are involved in this process, revising and rewriting the SIGN 139 guidelines which deal with patient deterioration. The original guideline was a consensus statement. Largely, we're currently looking at all the evidence, and the revised SIGN 139 guideline will look at the deteriorating patient in both the primary care and the secondary care setting. But certainly part of the process of revising the guideline, we are certainly looking at electronic solutions in the various aspects of recognising, but also escalating care for the deteriorating patient. So in that context, we're really pleased to welcome our speakers today.